Still on the common difficulties in special education in children, we're going to talk on the learning difficulties or learning disorders in children. Many children may struggle in school with some topic or skills from time to time, while children try hard and still struggle with a specific set of skills over time. It could be a sign of learning disorder. And having a learning disorder means that a child has a difficulty in one or more areas of learning, even when overall intelligence or motivation is not affected. Now, here are some of the symptoms of learning disorders. They are difficulty turning right from left, reversing letters, words, or numbers after first or second grade. Difficulties recognizing patterns or sorting items by size or shape. Difficulty understanding and following instructions or staying organized. Difficulty remembering what was just said or what was just read. Lacking coordination when moving around. Difficulty doing tasks with the hands like writing, cutting, drawing. Difficulty understanding the concept of time. All these are the symptoms of learning disorders in the children. What are the common examples of learning disorders in children? The common examples of learning disorders, learning difficulties in children are dyslexia, that is difficulty with reading, dyscalculia, difficulty with math, that is calculation in mathematics, and dysgraphia, difficulty with reading. Children with learning disorders may feel frustrated that they cannot master a subject despite trying hard, and may act helpless or withdraw when they are in the classroom. Learning disorders can also be present with emotional or behavioral disorders such as attention deficit hyperactivity disorder, ADHD, or anxiety. The combination of problems can make it particularly hard for a child to succeed in school. Properly diagnosing each other is crucial. That is, when a child is being diagnosed properly, it is very, very important. So it also helps the special education teacher to know the strategies to use on such a child. Intellectual disability is a term used when there are limits to a person's ability to learn at an expected level and function in daily life. Levels of intellectual disability vary greatly in children. Children with intellectual disability might have a hard time letting others know their wants and needs and taking care of themselves. Intellectual disability could cause a child to learn and develop more slowly than other children of the same age. It could take longer for a child with intellectual disability to learn to speak, walk, dress, or eat without help, and they could have trouble learning in school. Intellectual disability can be caused by a problem that starts anytime before a child turns 18 years old, even before birth. It can be caused by injury, disease, or a problem in the brain. For many children, the cause of their intellectual disability is not known. Some most common known causes of intellectual disability are Down syndrome, fetal alcohol syndrome, as mentioned earlier, Fragile X syndrome, genetic conditions, birth defect, and infections. This happens before birth, and while others happen while a baby is being born or soon after birth. Meanwhile, other causes of intellectual disability do not occur until a child is older. This might include serious head injury, stroke, or certain infections. As a parent or a special education teacher, you are expected to know the signs of intellectual disability in the child. For instance, many children with intellectual disability may sit up, crawl, or walk later than other children. They learn to talk later or have trouble speaking. They find it hard to remember things. They have trouble understanding social rules. They have trouble seeing the result of their actions and also have trouble solving problems. When your child is having all this or any of these, or as a special education teacher, you observe a child having any of these disabilities, you should know the strategies to use as a specialist use on the child who is having any of these problems.